Seborrheic dermatitis is an inflammatory skin condition that creates red, scaly patches that can be both uncomfortable and embarrassing. It primarily affects areas of your body with lots of oil-producing glands, such as the scalp, eyebrows, sides of the nose, and chest. Think of this condition as your skin's way of overreacting to normal things. You might have heard people call it by other names. When it appears on the scalp, many know it as dandruff in adults or cradle cap in babies. But it's all the same condition, just showing up in different places and with varying degrees of severity. It's important to note here that seborrheic dermatitis is not a contagious condition. What makes this condition unique is its tendency to come and go. You might have periods where your skin is perfectly clear, followed by times when the symptoms flare up, often triggered by various factors we'll get to in a minute. But now, how common is seborrheic dermatitis? Well, it is a relatively common condition, affecting about 3 to 5% of the general adult population. It's particularly prevalent among people with oily skin, those in colder climates, and individuals with certain health conditions, such as Parkinson's disease or HIV or AIDS. Types of seborrheic dermatitis. Seborrheic dermatitis presents differently depending on age, affected area, and the severity of symptoms. Here are the main types. Number 1. Scalp seborrheic dermatitis. This is the most common type, and it is often recognized as dandruff. This type results in white or yellow flakes that may fall from the scalp onto the shoulders. Although dandruff itself is mild, it can become more severe and cause scaling and redness. Number 2. Facial seborrheic dermatitis. When it appears on your face, it typically affects areas around the nose, eyebrows, eyelids, and behind the ears. The skin becomes red, scaly, and sometimes slightly greasy looking. Number 3. Body seborrheic dermatitis. This type is less common, but still significant. This type appears in areas like your chest, upper back, and around skin folds. These areas tend to be oily and can develop reddish patches with clear borders. Number 4. Infant seborrheic dermatitis or cradle cap. This type appears in babies, usually in their first few months of life. It shows up as thick, crusty, yellowish scales on the scalp, though it can spread to other areas. Causes of seborrheic dermatitis. The exact cause isn't entirely straightforward, but we know several factors play important roles. Number 1. Yeast overgrowth. The yeast Malassezia lives on the skin of most adults without causing problems. However, in people with seborrheic dermatitis, this yeast can multiply excessively, leading to irritation and inflammation, resulting in the characteristic redness, flakiness, and itchiness. Number 2. Excess oil production. People with seborrheic dermatitis tend to have more active oil glands, producing more oil than average. This oil creates an ideal environment for Malassezia to thrive, which contributes to the cycle of inflammation. Number 3. Immune response. Seborrheic dermatitis appears to involve an abnormal immune response, where the body's immune system reacts strongly to the presence of Malassezia. This response leads to inflammation, which causes symptoms to appear on the skin. Number 4. Genetics. If one or both parents have it, their children are more likely to develop it. Number 5. Environmental factors. Cold weather, low humidity, and exposure to harsh chemicals or soaps can all worsen symptoms. Seborrheic dermatitis may flare up more frequently in colder months and improve during warmer, humid weather. Number 6. Stress and fatigue. Emotional and physical stress can trigger or worsen seborrheic dermatitis. Many people notice an increase in symptoms during times of stress, such as exams, work pressure, or illness. Symptoms of seborrheic dermatitis. Seborrheic dermatitis symptoms can vary in intensity from mild flaking to more severe redness and itching. When seborrheic dermatitis appears on the scalp, it often presents as white or yellowish scales that flake off easily, often falling onto clothing. This flakiness can be accompanied by itching, which can vary in severity from mild irritation to intense discomfort. On the face, the symptoms tend to be more visible, causing patches of red, inflamed skin with greasy, yellowish scales. These patches are often tender, with a sensation of warmth due to inflammation. When it affects areas around the eyebrows, sides of the nose, and behind the ears, it can feel slightly uncomfortable or even sore. In infants with cradle cap, the condition presents as thick, greasy scales that are usually yellow or brown. Babies usually don't experience discomfort, but the condition can look alarming to parents. For adults with facial involvement, the affected areas may feel sensitive or itchy, particularly in the folds around the nose and ears, leading to occasional scratching or discomfort. The affected skin can also feel greasy to the touch, adding to the sense of discomfort and making individuals more self-conscious about the appearance of their skin. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of seborrheic dermatitis. Diagnosing seborrheic dermatitis typically involves a simple examination by a doctor. Dermatologists are often able to diagnose the condition by inspecting the affected areas and asking about symptom history. In most cases, additional testing isn't necessary, as the condition has a distinctive appearance that sets it apart from other skin issues. However, if there's any uncertainty, a dermatologist may take a skin sample or biopsy to rule out other conditions, such as psoriasis, eczema, or a fungal infection. Seborrheic dermatitis in infants, often recognized as cradle cap, is usually diagnosed visually without further tests. For adults, if symptoms are persistent and resistant to treatment, the doctor may look for underlying health conditions, like immune system issues, that could be exacerbating symptoms. Treatment for seborrheic dermatitis. Currently, there's no cure for seborrheic dermatitis, but symptoms can be effectively managed with treatment, and many people experience long periods without symptoms. Here are the main treatments. Number 1. Medicated shampoos and creams. For scalp seborrheic dermatitis, medicated shampoos containing ingredients like ketoconazole, selenium sulfide, or zinc pyrithione are often recommended. These ingredients help control yeast overgrowth and reduce inflammation. Regular use of these shampoos, often 2 to 3 times a week, can help keep dandruff and other symptoms at bay. Number 2. Antifungal treatments. Prescription antifungal creams, like ketoconazole or clotrimazole, can be applied for facial and body areas to reduce yeast growth. Apply a thin layer to affected areas once or twice daily. In some cases, oral antifungal medication may be prescribed for severe cases that don't respond to topical treatments. Number 3. Gentle cleansing routine. When washing affected areas, using a gentle cleanser daily can prevent irritation. Avoid harsh soaps or products containing strong fragrances, as these can worsen symptoms. After washing, pat the skin dry instead of rubbing to reduce further irritation. Also, use warm, not hot, water, as hot water can trigger more oil production. Number 4. Moisturize regularly. Moisturizing is key for preventing skin from becoming too dry, especially in colder months when humidity is low. Opt for non-comedogenic moisturizers, meaning they won't clog pores, which is essential for seborrheic dermatitis-prone areas like the face. Using moisturizers that contain natural oils, like coconut oil or olive oil, may also help lock in moisture and soothe the skin. Number 5. Sunlight exposure. For some people, moderate sunlight exposure can help improve symptoms. However, it's important to limit exposure to avoid sunburn and to wear sunscreen when necessary. Interestingly, the UV light from sunlight may help reduce the yeast that contributes to seborrheic dermatitis. Number 6. Tea tree oil. Tea tree oil has antifungal and anti-inflammatory properties, which may help reduce symptoms. Dilute a few drops in a carrier oil, like coconut oil, and apply it to the affected area. However, patch test first to ensure no irritation occurs. Number 7. Stress management. Since stress can trigger flare-ups, finding ways to manage stress, such as through exercise, meditation, or hobbies, can have a positive effect on seborrheic dermatitis symptoms. Maintaining a balanced lifestyle with sufficient sleep and regular relaxation practices can make a noticeable difference in reducing symptoms. At the end, while seborrheic dermatitis is a chronic condition, many people experience periods of remission where symptoms significantly improve or disappear. Now, we want to hear from you. Do you or someone you know have seborrheic dermatitis? Have you found any particular treatment that works best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.